Hello and welcome. My name is Tanya Chase. Today we are going to be discussing ischemic heart disease. Are you at risk and how to prevent it? But first and foremost, we need to understand what is ischemic heart disease. Ischemic heart disease is when heart arteries are narrowed, reducing the amount of blood and oxygen to the heart muscles, according to the American Heart Association. Another name is also coronary artery disease. So why is ischemic heart disease important to understand? Ischemic heart disease is one of the biggest causes of mortality death today. Ischemic heart disease accounts for 350.8 deaths in Anderson County, 392.3 deaths in Tennessee, and 316.4 deaths in the United States. So what causes ischemic heart disease? Well, ischemic heart disease is caused from the buildup of plaque or changes in the small blood vessels. And that is according to the National Heart, Lung, and Blood Institute. And over here you can see a picture of a normal artery and then one that is narrowing with the deposit of plaque. The deposit of plaque can come from your diet, or it can come from it breaking off from it in another part of the body and traveling to the heart, small blood vessels in the heart. So how do we know if we can develop ischemic heart disease? There are many risk factors for ischemic heart disease, and they include unhealthy lifestyles such as smoking, inactivity, obesity, and unhealthy diet, age, and gender. In fact, for men, the risk for ischemic heart disease increases around age 45. And then at 55, it increases for both men and women. Women have an increased risk for ischemic heart disease if they are diabetic, have a diagnosis of endometriosis, had gestational diabetes while pregnant, HIV positive, diagnosis of polycystic ovarian cancer or syndrome, or preeclampsia while pregnant. Genetics also plays a big role in ischemic heart disease. If there is a family history of ischemic heart disease, then you are more likely to develop ischemic heart disease. So how do we know if we have an ischemic heart episode? Well, the signs and symptoms are about the same, but they can be different according to whether it's an acute coronary event, which is your heart attack, or a chronic ischemic heart disease, which is just a continual. That's more your plaque buildups. Well, with the acute coronary event, the traditional or typical signs and symptoms are chest pain, dizziness, nausea, neck pain, shortness of breath, or weakness. For chronic ischemic heart disease, your signs and symptoms are chest pain, anxiety, nervousness, tiredness, neck pain. Now, these are the typical signs. What I just said was the typical signs of a ischemic heart episode. But they can differ according to gender. Men, when you talk about the chest pain, they will feel a squeezing that begins on exertion and may ease with rest. For women, they feel more of a pressure or tightening in the chest and can be followed with nausea, abdominal pain, vomiting, fatigue, and dizziness. And many times in women, they have no symptoms. So that's why we hear a lot of times the silent killer. So what do we do if we are at risk for developing ischemic heart disease? prevention is easy. Ischemic heart disease can be easily prevented by just changing the way we live. Some of the ways is smoking cessation. The American Heart Association it says the risk for development of ischemic heart disease decreases soon after you quit smoking. And then continually, you will see a decrease over time. Physical activity. Just adding 30 minutes a day or 30 minutes a week of physical activity can decrease the risk for ischemic heart disease. And it can be just as little as taking a walk. You have a dog, you can take him for a walk instead of letting him out on a chain. Get your family involved. Do a family walk. Just get up, get moving. Healthy weight. Healthy weight that's more for your obesity. If you are overweight, just losing 3 to 5% of your current weight can decrease your risk for developing ischemic heart disease. Eating healthier. By eating healthier, we're meaning adding fruits, vegetables, whole grains, limiting your saturated fats, trans fats, sodium, added sugars, and alcohol. As I had a friend tell me, shop the perimeter. If you're shopping the perimeter of the store, then you're going to get more of your healthier choices. I was going to say I have a brochure here, and that is it. If you have any questions, feel free to stop by and ask and talk. I have a brochure available here that has all the information, and then on the back it has some websites that is available for you to get some more information from.